important question because there are over 17 vaccines that are being used around the world now, and most countries have more than one vaccine that's being used in the program. So what would be easiest for countries and for people is to say, you know, one COVID vaccine is like another, and I can have one dose from one product and a different dose from another product. But we don't actually have the evidence for most of that mixing and matching. We do have evidence on both the immunogenicity and the safety of combining an AstraZeneca vaccine dose with either of the mRNA products, the Pfizer, the Moderna products. And that evidence shows that you get a really good response from an immune perspective, and these are safe things to do. What we know is that you get a better response if you start with the AstraZeneca vaccine and then give the mRNA vaccine, but both approaches can work. Apart from that, we don't yet have the evidence on other mix and match regimens, but those trials are underway and we're eagerly awaiting to see the results of the trials.
Kate, speak to us a little more about the safety of this approach.
Yes, so we have had clinical trials done combining with a first dose, either AstraZeneca or an mRNA vaccine, and then the second dose, switching over to the other product. And what we know about the safety is that the amount of reaction in your arm and some of the general short-term reactions that people get, not feeling well or a low-grade fever, are generally speaking the same whether you mix and match or whether you use the same regimen. So we do have safety evidence on this, and that's an important attribute of anything that we would recommend is to be sure we've looked at the safety.
눈을 붙일 때 나는 마음에 불을 붙여요.